All right. Well, we are approaching the end of the course and we're getting into the later chapters of your book. And in this case, we are looking at the biology of learning and memory, as the title shows here. Now, there's a few different things we want to cover right off the bat. Uh, Here, what we're going to do first is just review some basics of learning, right? If you've already had, well, presumably even a general psych intro psych course, you should know these basics, especially if you've had, though, a psychology of learning course, then you should be very well familiar with this kind of stuff already. But before we get into this, one of the things that we might want to keep in mind as we go through this chapter is to ask, is there really a difference between learning and memory in the first place? And this is maybe, at first pass, it seems like, well, duh, obviously there must be a difference. We have different words for them. But one way to think about this is that both of these cases involve, well, let me start over. Let's come up with a definition of learning before we do anything else. And there's lots of different ways we might try to approach defining learning, but one way to think about it is to think about the way in which a behavior changes over time. But I don't know if I love that definition. Certainly, things can change over time in a way that is not necessarily caused by learning. So let's try it again. Let's try talking about a way in which present behavior is influenced by past behavior. And that, I think, starts to become a little bit more precise. And so, at any point in time where we could talk about not necessarily just behavior, because I don't want to try to sound like a behaviorist here, anytime where we might suggest that cognition, present cognition, current cognition, what you're thinking about right now, is influenced by cognitions or behaviors in the past. Well, we could be talking about learning, right? But we could also be talking about memory because I could simply just, even if you were to ask me a question like, um, what did you have for breakfast this morning? My answer to the question, my ability to say toast, which that was my small breakfast this morning, uh, is is in fact influenced by my past. Most importantly, it's influenced by the fact that I really did, in fact, have toast for breakfast. So my current cognition and behavior is influenced by the past in this regard. So did I remember that or did I learn that? Well, it's both, right? And so I can talk about learning in the same way, right? So when it comes to um, my ability to drive my car. I drove to the office this morning. Uh, Again, I could ask the question, how did I do that? Because I've driven in the past. I learned to drive at some point in the past, and therefore, again, my ability to do that particular action was influenced by the past. So is that learning or memory? And we maybe start to see where this begins to be a little tricky to talk about whether we want to divide these two terms as separate constructs. Usually, we might intuitively think that memory is some sort of a visualization process that I can mentally see the slices of toast that I can recall eating for breakfast, right? And so it's that kind of imagery that is what we call memory and separate from learning, which is learning to perform some action or skill. But, it's that might be an arbitrary distinction, maybe not. But as we get into the notes a little bit, we're also going to start getting into the difference between explicit memory and implicit memory, and that is maybe a slightly more precise accounting of situations where we have this ability to visualize and explicitly recall certain events as opposed to more implicit things. So I will hold off on that discussion until we get to that particular slide here. So I just wanted to start with that. Now let's get into the basics. So, learning basics are these 2 points right here: Pavlovian conditioning, aka classical conditioning, and then we have Skinner and operant conditioning. So, you should hopefully know the basic story of Pavlov, I think, by now, right? So, Pavlov has the dogs. He's studying digestion, right? He's doing digestive physiology. He's trying to understand the function of what we would call now the parasympathetic nervous system, right? What are the stimuli that activate salivation? What are the stimuli that activate gastric secretions and enzymes in the stomach and the intestines? And so he's trying to map all of this stuff out. And of course, he's feeding the dogs and he's observing when they salivate. He's also got these crazy procedures he's performed with the dogs where he disconnects the esophagus from their stomach so that he can route the contents of the esophagus out into a pouch to prevent the food from ever getting to the stomach to see if that also still triggers gastric secretions. And of course, you can also record the rate of gastric secretions using the same procedure. Um, but then, kind of throwing a wrench into the whole business was the fact that the dogs began to salivate when one of the lab assistants, whose job was to feed the dogs, walked into the room. And this led Pavlov to try to suggest that it's possible that these same responses, the salivary response, might be triggered by any stimulus, not necessarily food in the mouth, but as long as there is some sort of conditional relationship or contingency between these two stimuli. So what we would say here is that the person whose job is to feed the dogs began perhaps as a neutral stimulus. That is, the dogs don't particularly respond to the presence of that person, but then once that person's presence is paired repeatedly with food, that conditional relationship is established. In order to nail this down, though, Pavlov switched the stimuli up a little bit here. He used a metronome. We might usually think of hearing the story of him ringing a bell, but in the original research, he was using a metronome that's just ticking away. And so the idea is that this metronome and the sound of that tick is a totally neutral stimulus at the start. Neutral is defined as by the fact that it does not elicit any specific response from the animal. But then the idea is that the dogs naturally salivate to the food. So that's a stimulus response relationship, of course. Food is the stimulus and salivation is the response. But we're going to call this an unconditioned stimulus, an unconditioned response. The reason for that is that we use this term nowadays, conditioning, to as a sort of as a synonym for learning, but it's it's really derived from a mistranslation of the original Russian that Pavlov is talking about, conditional learning. And the idea is that because, like I said, there's a conditional relationship between the neutral stimulus and the unconditioned stimulus here, the sound of the metronome and the food, that the dog eventually learns this conditional relationship. And then we end up kind of adapting the language here to talk about conditioning at this point. So, anyway, because the relationship between food and salivation is not learned, we'll call it an unconditional relationship. And so that's the unconditioned stimulus, food, and unconditioned response to salivation. So now we introduce the sound of the metronome, and over time, an association is formed. And now, after a sufficient number of repetitions of this, the dogs begin to salivate to the neutral stimulus. So it's no longer neutral anymore, right? It's now we're going to call it a conditioned stimulus, and that's the metronome. And salivating to the sound is now a conditioned response. This is sometimes also described as passive learning because of the idea that the stimulus comes first and the animal simply responds to it. And if in the absence of any stimulation, the animal would not be doing anything. So behavior is seen as being very much dependent on stimuli, right? And it's always a reaction to stimuli. Skinner had a different view, a more active view of learning. Animals operate on their environments and hence operant conditioning. And these operations, these behaviors are then followed by consequences, defined here as reinforcement and punishment. We want to importantly distinguish reinforcement from reward, right? Reward comes from Thorndike's law of effect, in which Thorndike is willing to talk about the consequence of this behavior satisfying some desire or some need that the animal wants. And so the animal is seeking the reward, right? But for Skinner, reinforcement does not mean reward. It doesn't mean that we're satisfying some desire that the animal has, but rather it's simply any kind of consequence that will increase the rate of that particular behavior that preceded it. Likewise, a punisher is not meant to be something negative necessarily. It's just any consequence that decreases the rate. So, yes, in many actual situations, the kind of stimuli that serve as reinforcers are oftentimes things we might label as pleasant, and the kind of things we might discover are punishers are things we would label as aversive. But the pleasurableness and the aversiveness of the stimuli are not how we define reinforcement and punishment, right? These are defined merely operationally. We apply a stimulus after a behavior, and if that stimulus increases the behavior, we're going to call it a reinforcer. If it's going to decrease the behavior, we'll call it a punisher. If it has no effect, then we'll call it neutral, right? We also have some images here that we can use to map this out. So here we see the Pavlovian experiment. Again, we've got a ticking metronome, as in it becomes a conditioned stimulus, and it's paired with the food, and then it creates the unconditioned response. I don't like the graph. Is that now that I think about it, it's the metronome should be labeled a neutral stimulus at first, right? That's what it says at the top of the screen there. After repetitions, the neutral stimulus becomes the conditioned stimulus, and it leads directly to the conditioned response. Down below, we see a case of operant conditioning involving a rat in a maze, and so the rat is faced with a junction, and if it takes one particular pathway and it finds some Fruit Loop cereal treats down at one end, it is more likely to return to that particular pathway on later trials. And so we have increased that tendency to go left, and we'll call it a reinforcer. On the other hand, if the animal takes that pathway and encounters some electrical shock, maybe the floor of the maze has a small metal plate that could be electrified, and the animal gets shocked as soon as it touches that. It's going to choose a different route the next time, most likely. So we have decreased the rate of going left here, and that would be a punisher. Now, for our purposes here, we want to understand what's going on in the brain. What actually changes in the brain when an animal learns to salivate to the metronome in a Pavlovian experiment, or when an animal learns to go left or to not go left, depending on what kind of stimulus is down that particular pathway. And this is where the research of Carl Lashley comes in. Lashley said that, or he at least hypothesized, that there could be a actual physical change somewhere in the brain, and he calls this the engram, right? And the engram is basically where this memory, if we want to call it that, has been stored. And so he wants to figure out where in the brain. Popular theme we've seen a little bit in this class of localization of function. Where are things happening in the brain? And in this case, what we're trying to localize is the actual memory trace, the engram. So Lashley comes up with the idea of training an animal to in a conditioning experiment, right? Using a Pavlovian experiment. So he's created a conditioned response, and then what he does next is that after the conditioned response has been fully established in the animal, he lesions some part of their brain. So he makes a small cut somewhere in the cortex. And the goal is to see if that cut in that one specific location eliminates the conditioned response. And if it does, then the logic would hold that the area that he just cut was the location of the engram. And if it doesn't work, right, if I make this cut and the animal still can perform the conditioned response, then I need to get a different animal and train them up again and make a cut in a different location of their brain and see what happens. And if that doesn't work, and then I have to get another animal and I have to train them up again and then make another cut somewhere else in their brain. What we have in this diagram on the bottom right is a map of all of the many different cuts that Lashley had tried and ultimately failed, right? Every single time he may performed a cut in some one location or another of an animal's brain, it fails to eliminate the conditioned response. So his conclusion is he essentially gives up. He says, I've tried all these locations, none of them eliminate the engram. So therefore, I don't believe the engram as we have defined it actually exists. His alternative are these two things labeled here at the bottom, equipotentiality and mass action. So here the idea is of equipotentiality. All cortical areas contribute equally. And what this means is that we don't have one area that's doing more work towards this particular behavior than another area. And then also the corresponding principle of mass action means the cortex works as an entire whole, that we don't have localized regions that do different jobs, right? Now, I label this here in parentheses as being somewhat erroneous, and maybe I should explain why. So um, he's he's on the right track to the extent that what we want to say here is that memories are not necessarily stored in one single very specific location, especially if we want to drill down all the way to talking about individual neurons, right? To suggest that memories are stored in one single neuron somewhere. That's really not true. So he's at least kind of moving in that direction, that we want to think of memory stored and any information stored in the brain as being more distributed across the brain, maybe distributed in a network as opposed to in a specific single neuron somewhere. But this idea that everything all works the same in the mass action, that's maybe a bit of an overreach there, because as we should already know, we know that we have different cortical lobes that do very different things. So mass action is not exactly the quite correct conclusion from this research. Let's look at another approach. So, just as Lashley has gone through this era here, mainly in the 1930s, I want to say, we move into the 1940s and then we get the work of Donald Hebb. And I think we've talked about Donald Hebb a couple of times, especially way back in the development of the brain chapter. And Hebb also gives us a theory of learning and memory that aligns very much with the emergence of memory theory as we usually learn it, short-term memory and long-term memory. But here it's called the dual trace hypothesis, and he's talking about short-term changes in the brain and long-term changes in the brain. And this is, of course, where we get the Hebb's law concept that we talked about in that developmental chapter. And we're going to spend a little bit more time to get into the details of Hebb's law in this particular chapter. So, what the dual trace hypothesis says is that when we have an experience, what's happening is that there has to be some pattern of brain activity that occurs during this experience. So, here I've labeled it as some sort of temporary reverberatory pattern, right? What is that? Um, so, just imagine, for example, that you are looking at let's let's imagine your best friend's face, right? So you're looking at this person's face, and that means that there's a certain set of neurons in the visual areas of the brain and the visual cortex. We've talked about simple cells and complex cells and end-stop cells and all that business. So presumably there's a specific pattern of features in that one person's face that activates a bunch of cells, and that activity in V1 leads to another pattern of activity in V2 and V5 and on into maybe the inferior temporal lobe. And so there's going to be some sort of pattern of activity that spreads across all of these different brain regions. That's this reverberatory pattern that I'm talking about. I label it temporary here because of the idea that you see that person's face and then you look somewhere else, right? So you're no longer looking at their face, and so the pattern of area in the pattern of activity in the visual parts of your brain has now changed a little bit, right? Because you went from looking at your friend's face to looking at a tree, perhaps, and so now everything has changed. But if you look back at your friend's face, the idea is that you're going to recreate that exact same reverberatory pattern again, right? And so you've reactivated those same pathways. And then again, you look somewhere else again. And then you look back at your friend. And now again, you have reactivated those same pathways again and again and again. So these temporary activations, once they have become repeated over and over again, creates more of a long-term change, right? And it's this long-term change where that particular pattern of activity spreading across the visual areas of the brain that correspond to seeing your friend's face move from being temporary patterns to more long-term, even permanent patterns. And this is where Hebb's law comes in. Hebb's law says neurons that fire together wire together, right? And so what we mean by that here is that this repeated activation of these same neural pathways that correspond to perceiving your friend's face, once you see that person's face again and again and again, like maybe the first time you ever met them, then the pathways become strengthened, makes it easier to recognize them. You could imagine that you might even be able to do a visual perception experiment where let's say I do this. Let's imagine this where let's say I create a stimulus set that has 200 different faces of different people. And within this stimulus set, I embed 50 photographs of people that you know, and therefore that are familiar to you. And the other, what did I say, 250? So let's say you got 50 familiar people and 200 unfamiliar people. And your task is simply to say whether you know them or not by pressing a button, yes or no. And the idea is that you might be faster at saying yes to the familiar person because seeing their face quickly activates pathways in the brain and synapses in the brain that are, we could say, primed to be activated. And therefore, you can process that visual information much faster, leading to a decision about familiarity compared to the time it takes to process the information of an unfamiliar face. That's at least one possible way of doing this research. I think as I describe it out loud, I see some problems with that research as I've defined it, but let's not worry about that. Um, and so Hebbs calls this sensitization or potentiation, right? So potentiation means that when a synapse becomes potentiated, it makes it easier to activate the action potential in the postsynaptic cell. And we're going to call this long-term potentiation because this process is one that involves an actual structural growth related change in the neurons that lasts for long periods of time. It doesn't necessarily last forever. That's important to realize. Why doesn't it last forever? Certainly, you remember your friend's face maybe forever, right? But not discounting any issues of amnesia, of course. But one thing I want to maybe think about is back to Pavlov. In Pavlov's experiment, when the dog learns to salivate to the ticking of the metronome, we could describe this in terms of short-term and long-term memory traces, right? When the dog hears the bell, the ticking of the metronome, not the bell, right, and then gets the food, there's a particular pattern of neural activity that gets activated, and again, this is all temporary, but over enough, it takes many repetitions, right? So after a sufficient number of repetitions, do we start to see long-term potentiation happening here? But does the dog salivate to clicking sounds forever and ever and ever? And the answer is no, because Pavlov also discovered the issue or the phenomenon we call extinction, right? So if we now present the conditioned stimulus, the ticking of the metronome, all by itself, for a time, the dog will salivate to that. But in order to keep this response active, we need to occasionally pair the food and the metronome together again. It doesn't have to be every single trial, but at least it has to occur with some regularity over time. If we eliminate the food completely and we just present the ticking of the metronome all by itself, then at some point in time, the dog will completely stop salivating to that sound. This is called extinction. And we might also call it some sort of reversing of the potentiation. And what would that be called? It's actually called long-term depression. And we're going to cover that at the very end of the notes here, but let's keep that in the back of your mind as we get to that here. Now, as I mentioned, memory is can be the same as learning. It may be distinct, but another way to think here is I had suggested that we would subdivide memory into two kinds here, explicit and implicit memory. And explicit memory is just what I was talking about when I talked about being able to remember what I had for breakfast, right? The fact that I can say, yes, I remember putting bread in the toaster and making toast, and that was it, right? So I can see it in my mind. Now, we probably ought to be careful here because the fact that I can visualize and see that toast, that is what we'll call a kind of visual imagery, and there's a lot of research, a lot of talk going on these days about what is called aphantasia, right? People who lack visual imagery. Does that mean that they lack explicit memory? No, it doesn't mean this at all, right? In fact, people who lack this kind of imagery can still quite easily tell you what they had for breakfast or anything like this, or if they witness some event, then they can describe it to you in the same amount of detail. So we don't see that this is really a requirement for calling something explicit memory, right? Explicit memory is simply just the ability to tell you exactly what happened, right? This explicit recall ability here. So I'm labeling it here as overlapping declarative knowledge because it's a statement that I can declare, right? So if you just ask me, any kind of factual knowledge that I have, like who is the first president of the U.S., and I say George Washington, then again, this is a kind of explicit recall. There's a fact, and I can access this fact and explicitly describe it to you. Implicit memory is different, and this is where it maybe starts to overlap a little bit with learning, right? So if we imagine Pavlov's dogs, can they tell you why they salivate to that ticking of the metronome? They might have a memory, they might have explicit memory of these events, right? Of the ticking and the food and all that sort of stuff. But it's not quite clear that they would necessarily have some sort of clear, exact, explicit knowledge of why they salivate when they hear that ticking sound. Let's try again with a better example because who knows what dogs are really thinking? We can't read their minds. Let's talk about riding a bicycle. So, if I were to ask you, first I could say, do you know how to ride a bike? You can say yes or no, but let's pretend it's yes. So that's a form of explicit memory. You have factual declarative knowledge of the fact that you can ride a bike. If I ask you, can you remember that time in which you learned how to ride a bike? You probably can say yes to that as well. You might remember where, like maybe outside, in a specific neighborhood or driveway or something like that. You might remember what your bicycle looked like. You might remember who was helping you, a parent or somebody. But if I were to ask you, what exactly did you learn that gave you the ability to ride a bike? This is where it gets harder. Sometimes you might be tempted to say, well, it was balance, right? But it's not really just balance, right? Because if you were on a bicycle upright, put your feet on the pedals and your hands on the handlebars, you could try to balance if you're not pedaling forward, but you can only stay up for a couple of seconds and you're going to tip back down. Even the most experienced bicycle rider is only going to be able to stay balanced on their bike for a few seconds. Maybe an expert could stay a few seconds longer than just a casual bicycle rider, but nevertheless, there's a limited amount of time you can stay balanced on a bicycle unless you're pedaling forward, right? So once you start pedaling forward and you give yourself that forward momentum, your bicycle becomes a gyroscope and it creates gyroscopic stability. And you have to make small adjustments with the handlebars as well. So when you're pedaling forward, you're also making small little adjustments with the handlebars. You're not just keeping them rigidly fixed. And so it's this tiny little balancing act between the rotation of the handlebars and therefore the rotation of the front wheel versus the spinning of the front wheel that creates gyroscopic stability. Now, if you're 5 or 6 years old, you don't know anything about gyroscopic dynamics. In fact, even if you're 35 years old, you probably don't know anything about gyroscopic dynamics. Unless you have an advanced degree in physics, you probably don't know anything about gyroscopic dynamics, at least in the form of explicit knowledge, right? But you do understand it implicitly, meaning that you have managed to figure out how to interact with those dynamics and harness those dynamics with your own perceptual motor skills, and you become a skilled bicyclist without knowing anything at all about what it is you have just learned, right? And that's what makes this implicit, right? You can't describe the actual gyroscopic dynamics that you have learned. You simply just perform them, right? You engage with them and you do it. And what's curious here is that I'm using this example sort of on purpose. There's an old kind of proverb, right? People say things like, it's just like riding a bike, you never forget. And that's where this becomes kind of interesting because there's a sense of truth to this that uh, I could maybe not go years without riding a bike and still hop on a bike um, and ride it, right? Let's talk about amnesia. So at the bottom, when I'm talking about explicit memory, amnesias, if I have brain damage that causes me to forget my past, that's retrograde amnesia. I could forget that I have ever ridden a bicycle before. I could even forget the event that in which that occurred, right? I don't remember that time of my life where I learned to ride the bike. My light timer went off here. Uh, and so I don't remember the bike and I don't remember having ridden it before. But so the explicit memory is gone. But if you were to give me the bike, I might surprise myself by hopping on it and riding and be like, oh, look, I can ride a bike. I don't remember, having learned to do this, but I still know how to do it. So the implicit memory is still intact, even though the amnesia has impacted my explicit recall of this fact. So that distinction turns out to be kind of important here, right? So we see that the implicit side of things aligns fairly well to the kind of stuff that we would call learning that's distinct from more explicit memories. But these are all still forms of memories as we would treat them. Now, when it comes to talking about amnesia, we would be remiss if we didn't talk about patient HM. And I think we may have talked about him just a little bit when we talked about different parts of the brain earlier in the book. But he's usually the name that comes up when we talk about the importance of the hippocampus in embedding new long-term memories, and so he had his hippocampus removed in a surgery. In fact, he had mostly his entire medial temporal lobe removed as a part of this surgery, right? So he had intractable seizures, intractable epilepsy, and the focus of those seizures was the medial temporal lobe, and that means that we have to remove that part of the brain here. So, the other treatments, anti-epileptics, were not working. So removing this part of the brain is the only way to treat these seizures. It's expected, of course, that he would have some memory problems and other significant impairments, but we can do this surgery. But the medial temporal lobe involves not just the temporal lobe cortical areas, neocortical areas themselves, but these underlying structures that include the hippocampus, and the areas that surround the hippocampus and sort of serve as an interface between the temporal cortex and the hippocampus. And these are called the entorhinal cortex, the parahippocampal cortex, and the perirhinal cortex. So all of these portions of his brain were removed. I see I have a floppy parentheses there, so I need to take that off. I'm sorry. And what we see with HM then is actually two kinds of amnesia. Most famously, we talk about anterograde amnesia, but he also did have retrograde amnesia as well. Retrograde amnesia is what I described already, forgetting the past, right? Forgetting memories that were already stored in my brain before this area has been damaged or removed. Now, HM did have some retrograde amnesia, but it was relatively short term in nature. I should say, that's not the greatest way to phrase it. It only affected a few months prior to the surgery, right? So memories that were relatively new-ish prior to the surgery. So he still remembers his childhood, for example. This idea that you can kind of start to forget your whole entire autobiographical memory, that's the kind of stuff we really only see in like in fiction and soap operas or cartoons. Somebody gets a bonk on the head and now they don't remember who they are and who their friends are and all that sort of stuff. That's really not realistic. It would take profound brain damage to cause something like that. So we don't see that kind of complete retrograde amnesia. It's usually more of like much more common. HM is pretty serious kind of surgery here, but let's say you have a concussion, a serious concussion, maybe you even lose consciousness for a time. You might forget events that occurred within a few hours prior to the concussion, right? So that's technically retrograde, but it's retrograde amnesia that only spans back a couple of hours. You will also likely have some anterograde amnesia as well, in the sense that you might not be able to remember events that occurred within the day after the concussion, or those memories might be at least very, very hazy. So anterograde amnesia is actually a bit more likely, right? So you have this little, what you see in this case is because it's a concussion and it's not such profound brain damage, you just sort of have a very limited time frame that's affected here, and it's not necessarily a complete and total loss, but it's more of a hazy, incomplete, partial memory. For HM, of course, though, what we have is certainly a more permanent retrograde amnesia for those few months prior to the surgery, but the surprising discovery was the permanent anterograde amnesia. Right now, he has the loss of ability to encode any new long-term memories. So now we say, oh, these areas of the brain, we usually talk about the hippocampus, but really it's all of this stuff, the medial temporal lobe and all these surrounding regions around the hippocampus are all pretty critical for encoding these new long-term memories here as well. But importantly here, this amnesia in HM, whether it's the retrograde part, actually I misspoke, as I just should have read my slide as I was talking. It says 1 to 2 years preceding the surgery, not months, but a couple of years, right? But it's the explicit memories, right? Um, Couple of things to say about that before I go into this next section here. Uh, One task that was used heavily with HM is called the mirror drawing task. And so this is a task in which you see two stars, one within the other, five-pointed stars, and your task is to trace a line between the two stars, but you can only see your hand as reflected in a mirror. And so it's a bit of a tricky thing to do. It takes time to master this. So when you first try it, you're going to make a lot of mistakes. But once you get used to drawing in a mirror, then you can perform the task pretty well. So what we see with HM is that in the first time he attempted to do this, he was pretty bad to start, like anybody else would be, and then he got better over time. And then on day two, so we say, okay, task is over. We come back on day two and we try it again. And the first thing we can say is, hey, HM, his name was Henri. We say, Henri, um, can you remember how to do this task? And he says, no, I don't know what this is, right? No, I don't remember having ever done this before. But nevertheless, as soon as we give it to him this second time, he starts performing pretty well. He shows carryover learning from the previous day. And even again on day three, even better. So even though each time he has no memory of ever having done it because he cannot encode this new memory of performing this task, the skills that he is acquiring are, in fact, there. So he can create the new implicit memory, but not the new explicit memories, right? One more thing to say about the hippocampus and its importance here is that as we get older, the hippocampus actually gets smaller. And so this is a part of the brain that it does, in fact, rely on neurogenesis. So again, recalling back to the development chapter, we learned about neurogenesis. So neurogenesis does happen in the hippocampus and also in those surrounding areas like the parahippocampal cortex and entorhinal cortex. And what's going to happen here is that that slows down. And as this slows down, the hippocampus is going to get smaller and smaller. So we can see this with structural MRI, just the overall volume and size of it gets smaller. And that that shrinking is at least one way to think about what causes some age-related forgetfulness. Here, we're not necessarily talking about Alzheimer's disease just because we might become somewhat more forgetful as we get older, although I have a note on that towards the bottom here. Um, but the idea is that just benign age-related forgetfulness could be attributed, at least in part, to this sort of decline in hippocampal function. Research has been showing, though, that if we engage in aerobic exercise, what's happening is that this increases a compound in the brain called BDNF, or brain-derived neurotrophic factor, which accelerates neurogenesis. And then what happens is that people who they do this intervention so that people it took older adults and get them moving and get the exercise going. And over the course of a year, their hippocampus actually began to get larger, not smaller. So we can sort of even reverse some of this age-related decline here and age-related memory function. But what this again shows is the important relationship between the hippocampus and encoding these memories. It's worth pointing out, though, that when it comes to something like Alzheimer's disease, the damage associated with these plaques and tangles that form in the brain, this tends to begin in the entorhinal cortex and spreads to the hippocampus. And as it does this, that's when we start to see the symptoms emerge of forgetfulness. In the very earliest stages, it might look like benign age-related forgetfulness, but it progresses from there and becomes a more serious concern at that point. But of course, what it does is it spreads throughout the medial temporal lobe, MTL, and here we start to see memory functioning just get progressively worse and worse when more and more of the medial temporal lobe begins to be affected by this. So we can see quite clearly here that with Lashley's idea of the mass action, not really, right? That these areas of the brain tend to be pretty critically important here, much more important than, say, other parts of the brain when it comes to the encoding and access of these memories here. Another thing to say about the hippocampus is spatial memory tends to be pretty important here as well. There's a lot of research on what are called place neurons, place cells in the hippocampus. We see this with a lot of animal research, right? So Rats and maze, classic psychology study here, right? What's happening here is that we can lesion the hippocampus in rats, and when we do this, now they're going to have a lot of trouble with these navigation kinds of tasks, maze learning tasks here. Research on birds here, we have Clark's nutcracker. And these kinds of birds, they will cache seeds for the winter, right? They create little stores of seeds. And Clark's nutcracker in particular will store up to 100,000 seeds every year, right? This is a lot. So the question is, can they really remember 100,000 food caches that they have stored in their environment? I don't know if they remember 100% of them, but they can remember a lot of them. And what we see is that animals that do this have, especially these particular species of birds, have a much larger hippocampus in comparison to the other kinds of other species of birds that do not engage in food caching behaviors. So this again would suggest that this kind of spatial landmark localization kinds of tasks really rely on the hippocampus as well. And speaking of Alzheimer's disease, one of the things we also see as Alzheimer's disease progresses is not just the typical kind of forgetfulness of forgetting events, but a decline in spatial ability and spatial awareness also accompanies this. And so, again, this also highlights the importance of the hippocampus for spatial memory as well. So what we're seeing here, as I have kind of been arguing here, is that in contrast to Lashley's conclusions about the principle of mass action, the medial temporal lobe is pretty critically important for memory, right? We're going to call it this interconnected memory hub because we have not just the temporal cortex itself, the neocortex, but we have a lot of interconnections between the hippocampus and the entorhinal cortex, and not to mention all this input coming from the sensory areas as well, right? Visual information feeds into it, auditory information, tactile information, it all feeds into that and would be stored there as memories, not to mention emotional centers as well, right? So the limbic areas. Keep in mind the hippocampus is considered to be part of the limbic system as well. So the idea here, we're going to call this the binding problem, right? All of these different details, the sensory details of the emotion, or sorry, of the memory and the emotional details of the emotion become bound together into a single, coherent, unified memory. And so this kind of binding of memories here happens in the medial temporal lobe, as we're going to understand it here as well. The temporal lobe as a whole is pretty important for this kind of stuff as well, because if we move, medial temporal lobe means more towards the middle, but what if we go a little towards the sides, the lateral temporal lobe? Now we have areas that we might connect to language and what's called Wernicke's area, right? This is our memory of words and word meanings and our ability to recognize and understand language. So we can talk about semantic memory here and other forms of conceptual knowledge about the concepts and ideas. We've mentioned the inferior temporal lobe already in this chapter when talking about recognizing your friend's face. But when we covered vision, we had a lot to say about the inferior temporal lobe for object recognition and the Watt pathways. And so, again, that's a form of memory as well, remembering what something looks like and being able to recognize a familiar friend or a familiar object. That's all. And of course, connecting it to words, right? I look at something and say, that's a book. That means that interconnections between the inferior temporal lobe for visual recognition and the lateral temporal lobe for accessing the words are all pretty important. And it's all interconnected, of course, with the medial temporal lobe for the binding and the encoding. So this whole area of the brain obviously is very important for memory. Okay, now I think that's probably a good place to stop. I think we've probably gone on long enough, but we're going to shift into a slightly different way of thinking about memory here. We're going to talk about working memory next. And then ultimately we need to move over into things happening at a cellular level. And so that's where we're going to go as we progress through the rest of these notes here. All right, so we'll call it a day on this one, and I'll see you next time.